Hey, okay, so to talk about this expand-along that we're going to start incorporating into your training now, just a couple things I want to mention. So this is like my introduction of the expand-along for you. So we're going to think about this tool as kind of like if you were to do strength training for your lungs. We're going to compare it to when you do like heavy back squats. And when you do heavy back squats or even Bulgarian squats, when you do squats with weight, it's different than when you do just regular air squats with no weight. So we're kind of training our lungs in that same way. We're training the lungs weighted. So you're resisting against the limited air supply when you breathe through this thing, and that's making your lungs stronger. And it's making specifically the muscles that expand the lungs stronger. So when you do this sort of training, think of how you would train heavy back squats and how you might need rest in between reps in order to do the heavy back squats or the heavy front squats or the goblet squats or the Bulgarian split squats again. So whatever variation of squatting you're doing with weight, you're going to treat it differently than if you were doing just plain old air squats, right? Because you would need more rest in order to keep the quality really high. So we're going to think about quality when we're taking these breaths, and we're thinking about, like I said, like strengthening your lungs so that when you go and do a high breathing workout just normally, or if you just go running, your lungs are then stronger and can carry you through that workout. So that's kind of the concept behind this thing, and personally when I use it, I notice a huge difference within like 2 weeks of using it. I can feel like my breathing is just much better in regular workouts. So I just want to go over like 2 tips when you're breathing through this. One is to take the breath in through your diaphragm first and then breathe into your lungs. So you're trying to pull air in through your diaphragm, so you should have your stomach expanding, your belly, like you should visibly see it growing because your diaphragm's filling up, and then you'll see your chest rise second. So first diaphragm, chest second, and then the other tip is how I like to do it is when you take the breath all the way in, you're going to fill up as much as you can, get everything full, and then you're going to remove the expand-along and try to take in just a little bit more air through your diaphragm with no expand-along. So at the end, you'll take it out and you'll go just a little bit more, and then you'll release and completely push out all the air and then start again. And the third tip is I want you to think about also leaning over so that the breath is a little bit easier to take in. So you might be like this, breathing in. When you lean over, then your lungs aren't weighted down and it's just easier to take a breath. So those are 3 tips. The first one was pulling in through your belly, through your diaphragm first, lungs second. The second tip was when you've reached the top of the breath and you can't take any more in with this expand-along, remove it and then try to take a little bit extra in with no expand-along. And the third is possibly leaning over to get a better breath. So then the resistance, those are 3 tips, and this is probably the 4th one. The resistance, you just want to make it to begin, since this is the first week that we're going to be adding this into your training, make the resistance so that you can have a smooth inhale. So it shouldn't take too long, but there is some resistance there. So you can just listen to how mine is, and I think this is probably where you want to set yours. But like I said, you don't want to have too much strain. Just a little bit of resistance is fine. So here we go. Okay, so that was 1 rep. Hopefully you heard how long it took. Shouldn't take too long. The first pull through the diaphragm was fairly easy, and then I pulled through my lungs and it started to slow down because it was getting a little harder. So set up your resistance to something similar, feel it out, play around with it, but don't make it too difficult. This is our first week, and just like if we were training, legs, if I introduce someone to weighted squats, of some form for the first time ever. We obviously wouldn't start too heavy, so that's kind of how you want to think about easing into your lung training. Not too much resistance, but enough that you can feel it, but you can still pay attention to form, which is going to be diaphragm first, chest second. Okay, good. I'm excited. Bye.